The components to a denture are going to look a lot different than the components to the partial. In the partial, we had a metal framework that from there acrylic was placed on there, and it provided the aesthetics of looking a little bit more natural. With a denture, the denture is going to consist of a denture base, which is this area here that's going to cover the alveolar ridge. So this is what it would be on a upper denture, on a maxillary, and this is what the base would be on a mandibular denture. It's this area right here that's going to basically sit on top of that alveolar ridge where the teeth would normally be. It also consists of a phalange, and a phalange is this area on a lower denture that kind of comes down over the gum tissue on the sides, on the buccal and lingual surfaces. That is considered the phalange. The phalange on a lower is going to kind of come down into that mylohyoid ridge, which is located on the lingual of the mandibular bone, and the oblique ridge, which is going to be located on the buccal or facial side of the mandible, basically. And then also it's going to entail the retromolar pad area. And if you remember, the retromolar pad on the mandibular is posterior to either the second or third molar. So it's this space that's right back here, right behind that second or third molar. The maxillary phalange is going to consist of basically this area here that's going to cover the gum tissue on the facial and buccal side, and also in here along the lingual. Since the maxillary is a full palate, it covers the entire palate, unlike the mandibular denture, because we have to accommodate for the tongue. We're not able to have it just be all one piece. So with this, the phalange again is going to be over in the back, over that maxillary tuberosity. And again, same thing as the retromolar pad on the mandibular. The maxillary tuberosity is posterior to the space back in here, to the second or third molar. Also going to consist of the post-stem, and the post-stem is only going to be located on the maxillary. And I don't know that if you can really see it very well, but there is a little bit of a ridge right back here where it kind of cups it a little bit, just very slightly, right back in the posterior of the denture. And that post-stem fits very nicely into that very posterior portion of the palate to create that retention or that seal that you want when it comes to having an upper denture, because that's going to prevent it from just falling out of your mouth. That post-stem is going to help with that seal and that retention. There have been times where we've had to sort of shorten this post-stem a little bit just because it went too far back and it started to gag some of our patients. We have to be careful with how we're adjusting this retromolar pad back here, because if we take away too much, then it's going to prevent the denture from getting that retention and that seal, and it's just going to plop down. So again, we do have to be careful with that. But that's the post-stem located posterior of the denture, kind of creates a little bit of a lip or a seal to allow for that retention to come in. And then of course it's going to consist of the artificial teeth, and teeth can be either made out of acrylic or porcelain, just as they can in a partial. Majority of teeth or dentures now are made with acrylic teeth, again due to the wear and tear that porcelain teeth have on the teeth as they're coming together. If you're having an upper and lower denture, you can imagine that just the wear and tear of the constant chewing forces and those porcelain teeth coming together is going to greatly recede and do some damage to that ridge that we're trying to preserve. So those are the components to the denture.